There are so many different aches and pains of pregnancy that are normal to feel, but that doesn't mean it's fun. And by the end, you're just ready to be done with them all. One thing that a lot of pregnant ladies feel is lower back pain. And as the pregnancy progresses and your belly gets bigger, the curve in your back is exaggerated and you start to compensate for the growing weight in the front by shifting the center of your gravity back. And this can put a lot of pressure and strain on our lower backs. In addition, you have bad posture, you walk funny, and this all contributes to back pain. With that said, lower back pain can also be a sign of preterm labor. So if it's not a problem you've had, it's not associated with like sitting for a long time or standing for a long time, that might just make your back hurt naturally, pay attention to it and look for other signs of preterm labor. Like if you have lower back pain, lower abdominal cramping, abdominal tightening, if you feel pressure in your stomach or down low, if you have any bleeding or spotting or leaking of fluid or an increase in discharge associated with the pain, those are all signs of preterm labor and you should call your doctor and get checked out. They'll decide if it's just normal pregnancy pain or if it's due to something more serious like preterm labor that needs to be investigated. Another type of pain that's typical to feel during pregnancy is just generalized pelvic pain or maybe a tender pubic bone. And this is because there's a ligament in the front of your pelvis and your body starts to release a hormone called relaxin. That makes sense because its job is to relax that pelvic joint and help the pelvis open slightly. It increases the internal diameter of your pelvis and increases the chances that the baby will fit through and be born vaginally. So if you're just kind of having generalized pelvic pain, you feel like your pubic bone's tender, it's making you waddle, you feel like your hips are going to pop out of place, that's your body's way of trying to increase the chances of you delivering vaginally. So just tell yourself that overall it's a good thing, but it's not very comfortable. If it gets severe though, talk with your doctor about it because some ladies do have more separation at that joint than they should have. They can look into it and again decide if anything needs to be done. A third type of pain that's normal to have during pregnancy is called round ligament pain. Your uterus isn't just hanging out in your belly, it's actually attached to various parts by ligaments, and these ligaments can be thought of as like elastics, and as your uterus grows and stretches, they do too. And then if you have sudden changes in movement, or if you just change movement and like you go a different direction, you're standing up out of a car, you're getting off your chair, you're on the floor and get up, all those sudden changes in direction and movement can cause those ligaments to tweak a little bit, and that can cause very severe and intense pain right away along the track of that ligament. So usually it's one-sided, again associated with movement, and it's felt in your groin area, like from about the level of your belly button on the side of your abdomen down into the pubic area. And so if this is what you're experiencing, it's probably round ligament pain. Usually it goes away as fast as it came on, but some women do just have like a more dull pain that lasts a longer period of time. So again, you're looking for something that's one-sided. If you're having cramping in your lower abdomen, again, a concern would be preterm labor. So what can you do about all these aches and pains? If you're pretty sure that it's not preterm labor, you're not worried about that, there are things you can do at home. Like for lower back pain, you can use a heating pad for 10 to 15 minutes at a time, just at the site of discomfort. You can take a warm bath before bedtime. That can do wonders. If that's not enough, then you can talk with your doctor about over-the-counter pain relievers that are safe during pregnancy. For sleep, there's a lot you can do to position your back and your pelvis appropriately so that it's more comfortable. Get a firm pillow or roll up a blanket and tilt yourself to one side and put that behind your back hip, and then also get a pillow or another rolled up blanket and put it underneath your belly so that it's not pulling and causing you to have pain. And then also put something in between your knees. Make sure your head's well supported. And this will help you sleep on your side, which you should do during pregnancy, and hopefully help you be more comfortable. In summary, if you're experiencing pain that you haven't had before, it seems new or concerning to you, you're not sure what it's due to, listen to your body. Call your doctor, and after asking you more specific questions and performing an exam, they'll decide if further investigation or treatment is warranted. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.